ignorance, an unwillingness to learn, empty-headed, being in a fog, lack of education. But if you bury your head in the sand and refuse to learn about new treatments for back pain, you may end up feeling constant throbbing, stabbing, burning, even numbing pain that you can't reverse. So wise up and get the facts.
Now, admittedly, dealing with back pain can be very difficult. Over 30 million Americans suffer with chronic back pain or are suffering with it on a regular basis. Millions of visits to emergency departments and primary care offices throughout this country for back pain, not always easily solved.
Right, it can be really debilitating. If your back hurts, you're not going to get out and exercise, and you're going to start gaining weight. That makes your back pain even worse, and it's this cycle that's just
Good news is, though,
vicious circle, like you said.
most back pain, most acute musculoskeletal back pain does respond very well to conservative measures. And so whether it's rest, a little physical therapy, actually getting out and being active again can improve it. But in some cases, no matter what you do, you're suffering with debilitating back pain. And we're very excited to say there actually could be new hope on the horizon for folks who do have chronic or what seems like untreatable back pain. And to explain further, we have Dr. Ralph Rashbaum here. Thank you for joining us. And I'm so glad you're here because today's show we've been highlighting some new therapies. And you have a really interesting therapy that you're using on patients.
The Medtronic Adaptive Stim Restore sensor is basically the newest iteration of spinal cord stimulation. Typically, this type of a device is used in end-stage treatments for chronic incapacitating back pain. This is done through a trial implant procedure where this wire is simply placed through a needle, advanced into the spinal canal. During that period of time, only during the trial, the lead is what's implanted. The patient goes home to see if the technology works.
So it doesn't work for everyone, but for some people, they see a significant change in their pain levels?
No, they have to have dramatic improvement in their pain. That's just the first step. Now with adaptive stim, we can now give them a technology that allows them to set it and forget it. This has enabled me, particularly in the geriatric population, that can't fuss with technology. They set it and literally forget it.
And walk us through, we have an animation here of how that device works.
What this animation is showing is relative position of the spinal cord relative to the leads. Those white leads are exactly what I'm dealing with right here. And as you move, as you sit, stand, lie down on your back, on your stomach, the relative position of the cord changes. Therefore, the stimulus intensity changes with that. If you do not set this at a comfortable level, which may be not the best level, you are constantly fidgeting with it, reprogramming. The device learns over time. Each time you upgrade the device program, it remembers that program until it's changed again. So the only thing they're required to do is recharge this. And this will last almost up to 10 years.
So this is not your run-of-the-mill acute back pain. Let's talk about who could benefit from this.
The typical pattern is somebody who has had back surgery, and that's failed. This is a patient with back and or leg pain. The problem with that is they've been reluctant or resistant to benefiting from anything. Tanya is a perfect example, having had previous surgeries that's left her debilitated.
And so you mentioned, Tanya, you've had this done. You had chronic debilitating back pain. How are you doing?
I'm doing very well now, thank you to this new technology here. Prior to receiving this, I was literally laid up on the couch all day, all day.
Well, thank you both so much for joining us today. We appreciate it. Glad you're feeling better, Tanya.